Okay. Good afternoon. I'm Richard Weiss, mathematician at NUS and CTO of Q Health. Our partner, Changi General Hospital, gave us what they consider a mission impossible: achieve 80% compliance for hip fracture surgery within 48 hours. But decades of classical effort have not been able to deliver this result. Why? It's because we're dealing with a mathematical optimization problem that is NP-hard, multi-objective, multi-period, large-scale, and under uncertainty. We have accepted this mission impossible to achieve a breakthrough beyond the average 40% compliance of Singapore hospitals for hip fracture surgery, while simultaneously addressing nursing overtime, surgeon wait for OP time, and cancellations. So since current systems are not equipped to handle this degree of complexity and precision, we offer QMO, a next-generation decision support system powered by quantum and AI forecasting, multi-objective optimization under uncertainty, and advanced hybrid architectures. And this plays into our value proposition, which mainly consists of forecasting, pre-scheduling, and adaptive re-optimization. And we back this with our publications in top-tier journals, such as Nature. Now, since we are scientist entrepreneurs, we back all of our claims with robust methodology validation. So if we consider one Friday with 33 surgeries, current systems used 17 out of 19 OTs at only 45% utilization. Our system, on the other hand, used only 11 of 19 OTs at nearly 80% utilization. So we saved 6 OTs without any cancellations and no reductions in electives and non-electives. And if we consider that even one of these OTs generates a daily revenue of $30,000, then these 6 OTs generate a monthly revenue of $5.4 million. So as you can see, the advantage of AI and quantum computing is very real, and the validation in the science is real, and the opportunity is at a current peak. And this is why now we are raising $2 million in seed funding in order to deploy our solutions across hospitals and affect deep tech transformation. So a big thank you to Moringa Ventures and Changi General Hospital for giving this a chance.
Move on to the Q&A session.
What sort of multi-objectives need to be optimized together? And can these also be conflicting objectives? And last part is, how does the unique characteristics of quantum computing make this the right technology to address this problem?
Okay, so I will start off with the multi-objective part. So as I initially mentioned, what we are focusing on is overtime. This is what we want to minimize. We want to we also want to minimize patient waiting time, and we want to increase utilization and revenue. And it's not only objectives what we're talking about; it's also constraints. So we want to assure certain constraints to have safety as a responsiveness to emergency and variation in surgery durations. And indeed, these objectives are conflicting with one another, which makes it especially tricky from a mathematical point of view to solve. As for quantum computing, this mathematical problem, the optimization problem we have, it's actually a special kind of problem. It's an NP-hard problem, which means it has a structure that makes it well suited for quantum computing to solve. But I think I can actually play the ball to Professor Chen, who can give some more insight.
Just add some additional comments. Actually, for quantum computing, it's different from classical computing, including GPU and supercomputer. And for this particular multi-objective problem, where you have a large searching space, and quantum computing can be very fast and also more accurate. And this has been published in the Nature Computational Science. And actually, our team is the first to show that for this particular problem, quantum computing really has advantage. Yeah.
So you are the first useful quantum computing?
So far, yes. Yeah, we are quite frontier in this area. I think now the whole world is looking for use case where quantum computing can really show advantage, and this multi-objective is really something. Yeah. Another thing is the joint extreme events, and we have another project which shows that if you use our quantum computing algorithm, you can really generate this randomness much better than the classic one. And for hospital, because there could be emergency. Let's say if there are car accidents, several emergency arrive, and in that case, for the digital twin, which can help the hospital to better prepare, this quantum computing definitely contribute much better than a classical one. Yeah.
So you mentioned hip fractures, right? So
Yeah.
Obviously, it can be anything.
Yeah, can be anything. Yeah.
So I understand why you started with hip fractures, but
Yeah.
are you going to move on to the next?
We are already moving on. Actually, so far, China General Hospital already signed NDA and DSA for this hip fracture, and we also process with NDA with this National Cancer Center, and they want us to help with the oncology special drugs. And actually, we met Singapore General Hospital, and they were also very excited, and now we are processing NDA as well. So basically for hospital, nobody want to touch, let's say, scheduling, because large scale, and it makes people stress. What we try to do is not to replace how they work. Instead, we are alongside. We make their day predictable. So in that case, we try to reduce overtime, make, let's say, our healthcare people happy, and also reduce, let's say, the waiting time for patients, so that, everything is predictable. And this is what we bring in. And so far, we start from, let's say, the hospital scheduling, but actually our roadmap is this year is scheduling, and next year we go with oncology drug and so on and so forth. We actually have a poster. We are very happy to discuss more offline. Yeah.
Okay, thank you. Thank you, judges, for the questions. Maybe the name will help up next.